Okay, so now in this video, we're going to talk about two separate arterial systems, or separate but same. The first one being the blood vessels leading into the cranium, and the second part of the video will talk about the direct supply into the brain tissue itself. So to start us off, we're actually looking right at the common carotid here, and we're looking from the patient's right. And it's a bit nuanced, but the common carotid on the right side, as we know, will stem directly from the brachiocephalic trunk, whereas on the left side, it will come directly off the aortic arch. So now, if we're following the common carotid upwards or superiorly, we'll notice its bifurcation. And that's namely the internal carotid, which is underneath this nerve here, and the external carotid. And as we know, the internal carotid will travel upwards. It's a bit hard to see in this model, but I'll show you it in a second. And it will go through the carotid canal up here and into the cranium. And likewise, we have the vertebral arteries, which are shown here in those cervical vertebrae transverse foramen. And this is, of course, bilateral, so we can see it from this other side as well. And they will join up together, the left and right vertebral arteries will, and they will move through the foramen magnum and eventually join to form the basilar. So you can think of it as the internal carotid coming in through that anterior surface and the vertebral arteries joining to come through the posterior together. Okay, so now we've transitioned to the superior view of what is the circle of Willis and its associated structures. And we're just going to kind of pick up where we left off of the left and the right vertebral arteries here ascending through the foramen magnum, which is this large hole in the occipital bone. And so what we get with the left and the right vertebral arteries is the basilar artery, which is this larger in diameter artery here. And there are three major branches this model shows. And starting from the bottom here, we have the anterior inferior cerebellar artery. Okay. And then we have our pontine arteries. And then just above it in the last branch up here is our superior cerebellar artery, which is right here, the red guy. And so this basilar artery will give rise to what is the left and the right posterior cerebellar artery. Nope, cerebral artery. That sounds better. So once again, the basilar gives rise to the right posterior cerebral artery and the left posterior cerebral artery. And they are connected to the middle cerebral artery by the posterior communicating, which is shown here and here. Right? And so the internal carotid is kind of underneath this, and as it's coming in through the carotid canal, and that directly leads to this middle cerebral artery on both sides. And also in this model, you can see right here, this is actually one of the first branches off that internal carotid, and that's the ophthalmic artery traveling through the optic canal there with the optic nerve. So continuing our trip around, we have middle cerebral here. And now moving anteriorly, we have the anterior cerebral artery, left and right. And then last in our trip, we just have the anterior communicating, which is right here. And that's all.